The state of Maine is nearing the end of a 30-day timeline set by the Center for Medicaid and Medicare Services. The state's request for an extension has been denied now. That deadline was set after a federal report found Maine paid out more than $45 million in improper MaineCare payments. News Center Maine's Christian Harsa has been following this for us, has more now from the State House.
When Dr. Mehmet Oz addressed Governor Janet Mills and Commissioner of the Department of Health and Human Services Sarah Gadney-Hones last month in his letter, he gave them 30 days to answer his list of 33 detailed questions. Also in that letter, Dr. Oz gave them the opportunity to ask for an extension, which they did. And on Friday, Dr. Oz denied that request.
While the same thing appears to be happening in Maine.
Oz says the magnitude and urgency of the situation in Maine shows a serious problem. The state's request did not provide sufficient justification or detail regarding the specific challenges preventing timely compliance with CMS's information request.
The records are due.
State House Republicans have repeatedly called for the Mills administration and DHS to take the allegations of fraud more seriously. And today, during their weekly press conference, GOP lawmakers said they're going to have to start answering to the feds.
We could have taken care of this in Maine. They could have taken care of their own program integrity, dealt with the fraud properly, but that obviously hasn't happened. So now the federal government has taken some more drastic measures to start recouping the money.
The governor's office says it will respond to CMS before the 30-day deadline ending on Sunday. However, in a statement, the Mills administration said denying the extension request is another intimidation attempt. The outcome of this inquiry, like all those the Trump administration launches, is predetermined because this is not a war on fraud. It is a war on those who stand up to the president. Dr. Oz has said that if he doesn't like what he sees in Maine's response,
we reserve the right to cut off payments entirely.
To put that into perspective, according to a September report from DHS, 30% of Mainers rely on MaineCare, and the program's budget was $4.7 billion last year, and $3 billion of that is federal funding. Now, there is reason to believe that CMS would actually withhold funding from Maine. Just last week, the agency deferred $260 million from Minnesota. Vice President J.D. Vance says that Minnesota could possibly get that money back if it starts taking allegations of fraud more seriously. In Augusta, Christian Harsa, News Center, Maine.